Today is May 26th, 2022. My name is Joe Todd. This is an interview with Melissa Abercrombie in Oklahoma City, Oklahoma. Ma'am, where were you born?
I was born here in Oklahoma City, Oklahoma.
When's your birthday?
December 2nd, 1980.
1980. Who was your father?
I don't know. I never knew my biological father.
Okay.
Yeah.
And your mother?
Her name is Judy Morris.
Morris. Okay.
Yes.
Did you go through school in Oklahoma City?
I did. I graduated from John Marshall High School. The original John Marshall High School before they moved locations to where it is now.
What year did you graduate?
1996.
1996. Who is your favorite teacher?
Probably Sam Botkin. He's a math teacher. And I wasn't very confident in math skills before then, and so he was a teacher that just kind of taught me that I could do something that I didn't think I could before. Mm-hmm. So I liked that about him. Yes. And he made it fun. Who makes Algebra 2 fun? I don't know, but he did. He figured it out.
What did you do for recreation in high school?
Oh, my goodness. I just really just hung out with my friends and kind of laze about teenager, you know. I didn't really have many hobbies. I worked when I was 16 years old, and then I just kind of did work, school, hang out with my friends, and that's it. I did like to play video games a little bit. Mm-hmm. Still do. Yeah.
Where'd you work?
Arby's was my first job.
Okay.
Yeah. Mm-hmm. Mm-hmm. Fast food place. I did Arby's and Sonic and just that type of stuff when I was a teenager.
What did you do in the summer when school was out?
Worked. I worked a lot. Okay. A lot, yeah. Yeah, growing up we didn't have a lot of money, and so really I knew if I wanted money, I wanted to buy stuff, I needed to go work for it.
Yes.
So
yes.
I worked a ton in the summer.
Okay.
And kind of hung out at home. Mm-hmm. And played video games, worked some more.
Where was home? What part of Oklahoma City?
It was on 88th and Walker in the Britton district. It's like a Britton district is what they're calling it now. Some people called it the North Highlands neighborhood.
Yes. What did you do after high school?
I started college and worked my way through college kind of part-time, working full-time, paying off college. And it took me quite a while to do that, but I gradually... It took me a long time to make it through college, actually, and I had kids and everything else before. So.
Where'd you go to college?
University of Central Oklahoma is where I graduated from with my bachelor's degree, and I'm currently in college still at Oklahoma City University for graduate school.
You got your BA in what?
It's a BSN in nursing.
Nursing.
Yes.
Okay. Why did you go into nursing?
Well, initially I went into nursing. I was volunteering at my church, and part of my job at church was taking prayer requests. I would get a lot of prayer requests from people with struggling with cancer diagnoses, and it just kind of, God laid it on my heart that, you know, how much illness and sickness there is in the world. And I thought up until then that maybe I would go be a teacher or go work in ministry, and I wasn't one of those. Lots of nurses say, I always knew I wanted to be a nurse. My mom was a nurse. My dad, nobody in my family really was a nurse. But it's one of those things that got planted in my head and I couldn't let go of. And so through nursing school, I thought I would go work in oncology because that's what originally got me interested in nursing and reading those statistics.
Now, oncology?
Yes, cancer.
Okay.
Mm-hmm.
Okay.
Yeah. So, yeah, reading all those statistics, I thought that I would do oncology. And kind of through the journey in nursing school, they really encourage you in nursing school to explore your personal history a little bit more and your personal story and what motivates you on a very basic, instinctive level. And through that process, I gravitated more toward mental health nursing, and so that's where I work now. Mm-hmm. I work on a residential unit with adolescents from the age of 12 to 17 who have been in multiple inpatient facilities throughout their life. Okay.
So you got when did you get your nursing degree?
Yes.
When?
2020.
2000.
So, yeah, I've been in nursing practice for 2 years.
2020.
Mm-hmm.
Now, how did you get into the mental health?
My mom has schizophrenia. And
has what?
schizophrenia.
Okay.
Yeah, she has schizophrenia. Mm-hmm. And it was hard at first because, you know, schizophrenia is a pretty debilitating mental illness.
What is schizophrenia?
So research is kind of back and forth on whether or not schizophrenia has an environmental or a biological cause, whether there's a genetic connection or whether it's triggered by some things that your brain is exposed to, drugs and alcohol being some of the risk factors. So what the research says is that it's a little bit of both. There's a genetic link. It can be handed down. Symptoms of schizophrenia, they divide them into positive and negative symptoms. So positive symptoms of schizophrenia, everybody knows about hallucinations or delusions. Maybe sometimes people who have schizophrenia will believe things that aren't real or see connections that don't really exist or believe in conspiracies. There's a really good movie called A Beautiful Mind that kind of depicted some of the paranoid type schizophrenia. So my mom, she had all of these conspiracy theories or believed people were sending her secret messages, or she would have auditory where she would hear things that weren't there. She'd have visual hallucinations, she'd see things that weren't there, and she'd also have tactile hallucinations where she could feel things. And so for her, it was a very, they call it, the scientific term for it, depersonalization, derealization. Mm-hmm. So she became another person, or reality became a different thing for her than it was for everyone else around. It's a complicated illness that gets worse over the course of someone's life.
Do they have a treatment for schizophrenia?
Most of the treatments include things that are called antipsychotic medications. Risperdal is what she takes now to help manage her hallucinations and delusions. Haldol is an older one that some people may be familiar with, but medications. The best intervention for my mother has been inpatient treatment, living in a residential facility, because I think when people think of mental illness, everyone thinks of depression or anxiety, or suicidality. But schizophrenia really shares more in common with diseases like Alzheimer's or Parkinson's that just are neurodegenerative. Your brain gets worse as the disease progresses, and the disease just has a natural progression. Okay. So my mother is not able to sustain self-care. She doesn't have the executive planning abilities to do simple things like manage a budget or ensure that she pays her bills. And then when she has kind of flare-ups, you get disconnected from reality, and she may not really be able to discern what's real and what's not. And so for her, being in inpatient residential treatment has been the best thing.
Okay.
Yeah.
Now, what facility do you work in now?
I work at St. Anthony's Hospital, Midtown, Oklahoma City.
Okay.
Yes.
Okay. What do you do at St. Anthony's?
So I'm a nurse, and I have some female patients and male patients that are separated. I monitor them for mental status changes. I make sure they get their medications on time. I make sure that if there's a change in acuity that the doctor's made aware of. A lot of our patients, all of our patients are there because they present an imminent risk to themselves or to other people. Our unit has kids that struggle with aggression. They've gotten aggressive at home with their family members, or with people out in the community, or with themselves, harming themselves.
Mm-hmm. Mm-hmm. Now, how does a person get admitted to this facility?
Well, some of our most recent admissions usually violence is what gets them there. I know there's a lot of debate in the community of mental health advocates about the link between violence and mental illness, and I'm sure that's running in the news a lot now in relation to school shootings. Personally, I believe there's a very distinct, very clear link of violence and mental illness. All of our kids are there because at some point they've gotten violent with other people. Whether or not their current problem is, feeling suicidal, it's always violence. Many of our kids have attachment disorders. They have parents that were either incarcerated when they were young, or they were victims of abuse. But violence is usually the trigger that causes them to get approved, because it's a very restrictive setting. My unit's locked. They have to ask to go to the bathroom. All the doors are shut when they're not in use. They have to have their bedroom doors open. Some of them have to be monitored continuously around the clock.
So a doctor is one that gets the person admitted? Or?
Yes, a physician will co-sign that they have debilitating illness and they need treatment. then that goes through the Oklahoma Health Care Authority, and tax dollars pay for their treatment through the Oklahoma Health Care Authority.
Okay, okay. Tip, what is your average day?
Well, right now I'm working night shift, so I show up and 7 o'clock is sharp as medications. So I do my med pass.
Your what?
A med pass. I give all the kids their medications.
Okay.
So we do all the medications, and then we try to establish a very stable bedtime routine. A lot of our kids' trauma history happened at bedtime. So sometimes there will be crisis situations with them where they have increased anxiety and I have to intervene there. Maybe they just need somebody to talk to them. Maybe something has happened. They usually have phone calls with family members in the evening too. And so really a lot of my job is just monitoring for things that have changed. All of my patients have a baseline. They're residential. They're there with us for months or even years. And so I get to know these kids pretty well. And even if they don't tell me something's off, if something seems off with them, I try to investigate that. Okay. So after we get them in bed, it's just monitoring them while they sleep for safety's sake. Okay. Because sometimes that's when we'll have issues.
Okay. How about security?
So we do have security guards. There's a process for if the current staff on the unit's not able to handle. I am supported by mental health technicians and behavioral health specialists. And if a crisis comes up that we can't, we call what's called a code 39. It's just kind of like when you would call a code in a medical hospital, and then additional people show up to give you some more hands.
Okay.
So, and security guards are a part of that work for St. Anthony's Hospital.
Okay. Do you have security in your facility?
They cover the whole hospital.
Okay.
So they're not there with me
Okay.
around the clock.
Okay, okay. Do you have counselors come in?
Yes, we have therapists that work on the unit that are devoted to our unit and our kids. So they have a stable assigned therapist.
Okay. What is the most common mental problem in your facility? Is that a fair question?
Yeah, I would say that the diagnosis-wise, we would term it what's called disruptive mood dysregulation disorder, or DMDD.
And what is that?
It is when, we all have encounter stimuli throughout the day. And these kids would have a stimulus, and their reaction would be out of proportion to the stimulus. So something negative would happen. Say, one recent one, we had a patient who's on the phone with his mom, and the little cord that goes into the wall has worn down a little bit, and so if people aren't aware, it'll accidentally get disconnected. So this patient's on the phone with his mom, the phone accidentally comes out of the wall, and instead of just coming and saying, hey, I got disconnected, can you help me, can you call my mom again, he hits the roof, yells, screams, curses, throws things, starts making threats against people. He's not really connecting that, the nursing diagnosis we have for it is ineffective problem solving. Okay. A problem arises and he doesn't have the skills that match his age to be able to fix it on his own.
Okay. What's the average age?
Right now, I would say about 15, 16.
Okay. How many facilities are there like this in the area?
Not many. There is Cedar Ridge, there's our program. Some of our kids go to Integris, has an inpatient unit. There was Shadow Mountain, but it closed. Mm-hmm. Actually, one of the most heartbreaking things about my job is these kids will come in and they'll do their treatment program for years. They will do their absolute level best to rise to the goal that we set for them. Our goal for them is always we'll develop the skills necessary to be successful in the community. Because legally we are supposed to move them to the least restrictive setting possible as soon as possible. And so these children will work very hard to overcome the symptoms of their mental issues. And they will discharge from our facility, sometimes with care of their caseworkers. And I'll inquire, where's this child going now? Because you get invested and you're concerned about their safety and their wellness. And sometimes the answer is, well, I don't know. I'm not sure. We're going to try to find a group home for them. And a lot of our kids will run away from these group homes. There's one called Spec Homes that one of our kids was at before, and he had a mental health crisis, and he destroyed windows. Then he has the broken glass, and then he wants to hurt himself or other people with the broken glass. And so he came from this group home, and now he cannot go back there because he's dangerous when he's not doing well. And he's 15 now, and so we can keep him until he's 18. And then after that, once they approach adulthood, there's maybe 2 or 3 places that I can think of in the state to try to secure a living place for him. Griffin Memorial is one of our biggest, and there's just about 105 beds, I think, for the entire state of Oklahoma, and that's the only state-run hospital for adults in Oklahoma. There's another facility in Midwest City that my mom was actually going to come to, but there aren't enough places. We don't take federal money. We don't have federal funding here that supports these. It's all either private insurance or state funding.
Okay. Do you get donations?
I wish that we get all of these grants and donations and wonderful things, but that's not really what funds our unit.
No.
And it wouldn't be enough probably
Okay.
to really help.
How can you tell when a person is ready to exit and go to a group home?
I think a lot of the trigger, and this, a lot of the kids will say, well, if I'm good for 30 days, if I can just be good for 30 days, if I can just be stable for 30 days, then they'll try to send me to a more, a less restrictive setting. Mm-hmm. My concern as their nurse is that they come from our facility, which is very restrictive. As I mentioned, all the doors are locked. They have to ask to go to the bathroom. Sometimes we have to watch them go to the bathroom. Super restrictive setting. And then they get sent to this group home where they are still supervised, but they have a lot more freedom very abruptly. Mm-hmm. And these kids have impulse control disorders. And so when you go from, it's like riding a bike. When you go from having your training wheels all the way down, or even a toddler bicycle where basically your mom or your dad is pushing the bike for you. Mm-hmm. And that's how I kind of see my role. Sometimes I have to push the bike for these kids. And then you go to where you're pedaling the bike yourself with the training wheels all the way down. And then we send you to a group home and just take the training wheels completely off and expect you to stay stable. I feel like we set the kids up for failure with all the gaps in care because we see a lot of, recidivism, a lot of readmissions. One of our patients was there for 2.5 years, and she went back home with her parents, and within 10 days she was in an emergency room. So that's the heartbreaking part of my job, just to know that there's such a lack of places to care for these kids that need it.
Is there a plan from your facility, something in between your facility and the group home? Is there something that they can do in between?
If there's a plan, I'm not privy to it. Okay. And I'm certain that they would have the will and the temerity to do it, because I know that St. Anthony's has, the history of their mission has been to care for disadvantaged, vulnerable populations. Some of the earliest ledgers from the Sisters of St. Mary include the acronym Our Dear Lord as the payer, because they relied upon, donations, and they would go out and they would beg for food to feed these people. And so they considered it that it was the Lord's provision that these people were able to be taken care of. So I know that St. Anthony's would want to expand that and be interested in it. That just there's not real parity in mental health funding. Sometimes I feel like in the community, the problems that people have that are disabling, that are physical in nature or biological in nature, don't have the same stigma. I know with my mother's mental illness, we didn't really talk about it with people when she was going through a hard time, because people don't know what to do with that. People don't really respond the same way when you tell them that your mom's having like a mental health crisis and she's in the crisis center, and as they do of, we're having another round of chemo. Mm-hmm. And to me it's equivalent, it's the same, but I don't feel like society does a good job with the equivalency in funding or in social support.
Do you ever take these children out of the facility to go out somewhere?
Yes, when they've maintained some stable behavior and they are doing well, we take them out. We have TAS, Therapeutic Activity Specialists.
TAS?
Yes, Therapeutic Activity Specialists.
Okay.
That come and they do more of the fun type of things with them. So recently they took them out to the zoo so they could have a field trip. Yeah, and there's a playground, they go and we try to take them outside and get them active. We have a gym downstairs where they can go and get some physical activity as well. They do have to be safe and stable to do that. So not all of our patients get that opportunity sometimes.
When they come back from these field trips, what's their attitude?
I think a lot of them feel proud that they've earned that. And that's another really hard thing about my jobs, because to me, getting to do life-enriching things, like going out to the zoo, that's a basic human need. That's a basic developmental need. And these kids have the perspective that they have to earn those basic needs. Because safety always has to come first. Safety has to come before freedom. So they feel a sense of pride that they earned that, which is, good in a way, but it's also really hard to accept that they would have to earn those things.
What would you like to see happen at St. Anthony's?
I would like to see better pay for our direct care staff. It seems that we have an easier time and we focus a lot on attracting nurses to come work for us, and our direct care staff does a lot of the day-to-day nitty-gritty. And an individual can make as much working at Costco as they can come working for high-risk teenagers. And who would do that? Somebody that has a certain passion for it would do that. I'd also like to see more education for our direct care workers. I would like to see it become something that requires at least accreditation or licensure, because these kids are at a high risk for abuse even when they are inpatient with us. And so I think it's very important that we get well-paid positions, well-educated positions, and that only comes with funding. I feel like we need to reform our mental health payment options, insurance companies that review these kids. We don't take private insurance at our facility because private insurance reviews every 3 to 4 days. So if a child is stable for 3 to 4 days, they'll say, oh, they're ready for discharge. Well, who can't behave for 3 to 4 days to get what they want, They can work that. They can game that system pretty well. And then within a week, they're destabilized again. Because their home lives are unstable, or because they're unstable, or because of the nature of their illness, whatever the reason may be. And so we need to hold these insurance companies that make billions of dollars profit every year accountable to actually do what they're being paid to do.
Yes. Who is in charge of the direct care staff?
We have a nurse manager that oversees all of the nurses. The nurses oversee the direct care staff, our mental health technicians. And so that's our chain of command on the unit.
Okay. How many staff members do you have?
Right now, we will have 2 nurses, 2 direct care staff on each side. We separate the boys and the girls.
Okay.
Yeah. Our ratio is supposed to be 1 staff member to 6 kids right now, while they're awake, and 1 staff member to 8 kids while they're asleep. And they don't differentiate whether that's a mental health technician or a nurse, but we do have to have a minimum of 2 nurses on our unit at all times.
Okay. Now you say you're going to University of Oklahoma now?
Oklahoma City University.
Oklahoma City University?
Yes.
And you're in nursing?
Yes. I'm pursuing what's called a psychiatric mental health nurse practitioner. The degree is an advanced nursing practice degree, but my focus will be psychiatric mental health. It's a DNP.
Okay. Now, is this like an RN or?
I'll still be a licensed nurse, but I'll have a doctoral degree.
Okay.
Yes.
What else about St. Anthony's you want to talk about? Anything?
St. Anthony's, I feel, has really committed themselves to being one of the most comprehensive behavioral health treatment in the state. In our building, we do all the way from 6 years old to adulthood, and we have a geriatric unit on the south side. I'm very proud of my employer because I know a lot of companies wouldn't take on the hard work. A lot of the kids that we have on our unit, it's very hard to find placement for them other places. So these kids feel unwanted. And so I'm very proud of my employer for standing in those gaps.
Well, this is a very good interview.
Thank you.
I have actually learned a lot.
Thank you. I'm really passionate about mental health.
Yes, I can tell. I'm trying to think any more questions I could have. We talked about what you want to see happen. What do you want to do in the future?
And well, in the future, I would like to open group homes for these kids that age out of our facility. We have some organizations here like Pivot, like Sisu Youth Services that do great work in that area. I'd like to reach out to some of those organizations, partner with them, see where the gaps in care are for them. If we just need more beds, more care, if they're getting nursing care, if they're getting medication management while they're outpatient. My mom was homeless for about 10 years before she wound up being hospitalized now. I would love to do outreach to the homeless community. I know that there's a movement in America that does, mobile medication or mobile medicine. I would love to see mobile mental health become a part of that. And hopefully, I can meet some of these homeless individuals where they're at versus, right now, in order to get them treatment, they would have to come seek it out from us. And these are obviously people that have rejected society and everything it stands for. And so I think if they're going to get help and care, we have to go to them and meet them where they are at on their terms. So I would love to be able to do that and do what people did for my mom in getting her off the street and getting her into treatment.
Do you have any children with autism?
I do not. I don't. I do have a cousin who has a daughter with Asperger's, but both of my kids, as far as I can tell right now, are very neurotypical.
Okay. Well, this is a very good interview.
Thank you, Joe. I'm grateful for the opportunity to come and talk today.
I want to thank you for the interview. And again, is there anything else you want to talk about?
No, sir.
Okay. Well, again, this is May 26th, 2022. My name is Joe Todd. This has been an interview with Melissa Abercrombie in Oklahoma City. Thank you.